Hey everyone, I'm Abdullah Abu Bakar, a fear-free certified small animal intern working in Lahore, Pakistan. I am the ambassador of International Veterinary Students Association Standing Committee on Animal Welfare. Today we're going to talk about the animal welfare in beef fattening farms of Pakistan. We have Dr. Muhammad Talha with us today. Dr. Talha, can you please introduce yourself?
Assalamu alaikum. Hello. First of all, I would like to express my thanks and gratitude to International Veterinary Student Association for providing me with this opportunity to share my thoughts and knowledge on fattening farm and animal welfare in Pakistan. I am Dr. Muhammad Talha. I recently worked at several fattening farms across Pakistan, and currently I'm working at Tazik Meats and Food, Pakistan.
Thank you so much for your kind words and introduction. Without wasting any time, I'll move to the questions. My first question is, what are the most common animal welfare challenges you observe in beef fattening farms of Pakistan, and how are they addressed?
So, the first thing I would like to talk about the challenges that we face in Pakistan is about animal stress, especially during animal transport when they are bring from their local mandis to the farm. When they are brought to the farm, they often get inadequate rest during the traveling and inadequate water supply, which can be managed. When they arrive at the farms, there are often issues like mishandling of animals due to untrained workers, or sometimes the bedding or the living conditions are not up to the standards. But these all things are manageable with some investment at the farm.
That gives us a better understanding. Thank you. I'll move to the next question. How do you ensure that the cattle have adequate space, comfort, food, and water in the fattening process?
So for this purpose, animals are often divided into groups and subgroups, and their number is decided by calculated stocking density and the bunk space available at each shed and subshed. For the purpose of cleaning feed troughs and water troughs, they are often coated on daily to weekly basis with lime, and we often use sometimes chlorine or other chemicals to disinfect water, and water TDS is also maintained. For the purpose of feed, we don't have often TMR mixers at a typical commercial farm in Pakistan. I'm talking about only fattening farms. In dairy sectors, they are available, but at fattening farms, often the feed is mixed through manual mixing on the floor. So there's a sheet spread on the floor, or often the separate area is made where only the feed is mixed cleanly and is no contamination. It's made sure.
That's very insightful. Thank you. I'll move to the next question now. Are there any concerns regarding the use of growth promoters or antibiotics? How do you manage their ethical use?
Uh, at a standard commercial farm, promoters are rarely used, although they are not common, but sometimes locally farms use the growth promoters to get early result, and the antibiotics are used for therapeutic purpose only at farms unless the animal is facing with some disease or another condition which require us to inject the antibiotics. And proper withdrawal time is also provided to the animal before the animal is sent for slaughtering purpose, which ensures the AMR is reduced.
I appreciate your input on that. Thank you. I'll move to the next question now. What steps are taken on the farm to reduce the stress and improve the mental well being of the animals?
To reduce animal stress, we often try our best to provide animal with its five freedom. So the animal always have access to clean water and food. The animal is always provided with adequate space to move and enjoy itself. Also, the bedding is maintained so the animal doesn't feel uncomfortable. The next thing we do is train our workers so the animal is put under minimum stress during different procedures.
That leads me to my next question. How do you monitor and manage the diseases or injuries among cattle, and what protocols are followed for treatment?
So, for this purpose, we do regular daily checkups, uh, mostly at dawn, to make sure no animal is sick. And if we observe any animals, we have a separate pen where we separate the animals and treat them separately. Also, their health record is maintained, including their vaccination record and different protocols that we administer. So, when we send the animals to slaughter, we have already the record of when an animal was injected with antibiotics.
Thank you so much for your time and addressing all the questions in a great way. It was a pleasure having you with us today, and I hope that animal welfare will always be a priority for all of us.